Daddy issues is one of the most casually thrown around psychological labels and one of the most misunderstood. It is often used as a lazy explanation for someone's relationship choices, but in reality, it points to something far more ordinary and far more human, which is the long term effects of a child's relationship with their father or the primary male caregiver they had while growing up. This isn't a diagnosis, it is about understanding how early relational patterns shape adult behavior. At its core, the term describes attachment wounds or unmet emotional needs that formed in relation to a father figure. This can happen whether the father was absent physically or emotionally, inconsistent, authoritarian or overly critical, emotionally immature, unreliable or unsafe, or present but disengaged. Importantly, you can grow up in a two-parent household and still have these issues. Presence is not the same as emotional availability. Also, it does not apply only to women. Men have father-related wounds too. They just tend to show up differently. In relationships, it can show up as attraction to emotionally unavailable partners, fear of abandonment or rejection, overtolerance of poor treatment, struggles with trust or vulnerability, and seeking approval from authority figures or romantic partners. In self-perception, it can show up as difficulty feeling enough without external validation, chasing over achievement to earn worth, deep discomfort with dependence or asking for help, or harsh self-criticism or perfectionism. In boundaries and power dynamic, it can express itself as difficulty expressing your needs, people pleasing or over accommodation, swinging between hyper independence and emotional dependence. Fathers or father figures often represent a child's first experience of external authority, protection, and validation outside the mother child bond. From this relationship, many people unconsciously learn what love from men feels like, whether affection must be earned, whether authority is safe or threatening, and whether emotional needs will be respected. When that template is unstable, the adult nervous system keeps searching for a solution. But searching for the resolution you don't have the right template for is what breeds problem and all of the issues mentioned earlier. So for someone who has these daddy issues, what does healing looks like? Healing father-related wounds does not center around demonizing your father or rewriting history to fit a narrative. The first phase of it needs you to name what was missing, accept the impact, and understand your patterns without self-judgment. Many fathers did the best they could with what they had. That can be true, and their limitations can still have affected you. Both can coexist. The next phase of healing needs you to learn to tolerate stable elder relationships, which can feel boring at first. Separate your self-worth from approval. Learn to develop boundaries without guilt. Notice when you're replaying old dynamics and choosing differently. Reparenting yourself emotionally by being consistent, constantly reassuring yourself and maintaining your self-respect, especially in romance-related scenarios. Therapy can help, but so can conscious pattern interruption and honest self-observation. Daddy issues are not a personality trait. They are unfinished emotional business, and unfinished things can be completed.